get confused about this with ketamine. It's a disassociative. So it's in some ways disconnecting you to your body. So how is that relevant when we're talking about healing and actually understanding your pain?
The way I've seen it be most useful in ketamine-assisted psychotherapy is that it does allow us to disassociate from the pain, but not the reality of the experiences we've had.
Okay, wait. Let's go slower on this. So you get removed from your current pain, but not the story around the pain?
So let's back up for a second.
Yeah.
Three models:
Okay.
molecular, psycholytic, and psychedelic.
Okay.
Molecular is just the molecule itself is super helpful for pain, anesthesia, depression, synaptogenesis, creating new neural pathways. The molecule in and of itself is quite helpful.
So hold on, sorry, synaptogenesis. So you're saying that this drug can actually create on its own new neural pathways?
Yeah, there have been studies more often with mice. So the transition from mice to human. Okay. But yeah, a month out, the dendrites grow more branches for about a month out after the mice are dosed with ketamine, which is why it's useful. And there's conversation around cognitive flexibility being something that can be utilized with ketamine and the other transformative medicines on the table for legalization.
Okay, wonderful. I'm going to try not to interrupt you, but it's just too good. Okay, so we're starting out with molecular. Yeah.
But the molecular, we don't have that much to talk, or I don't, because as as somebody in ketamine-assisted psychotherapy, I take advantage of the molecular components, but I don't actually harness it like that. A lot of the infusion clinics run by anesthesiologists, you can go and get an IV of ketamine, and this could be quite helpful for depression, but there is, for some, a limit to how long this will last, and then you will have to go back for maintenance.
What would be an average time frame that your depression would lift for how long, and then you'd have to go back?
It's so hard to say. It was rescheduled in 2019 as Spravato provided intranasally as a medication for treatment-resistant depression. And the way it was looked at was, 6 administrations in a 3-week period. But that was specific to the amount they could get in the body reasonably and the result. And it lasted, the antidepressant effects. This was really for, not only treatment-resistant depression, but high suicidality. And it was quite impressively helpful. But maintenance was required, sometimes after 1 month, sometimes after 3 months. It varied. But it doesn't tend to be like, oh, I had ketamine and now it's behind me and I will never have this depression again and it's cured. Like, it's not a cure from the molecular model.
The molecular model isn't long-term cure, and nor is the infusion.
Right, because unless the infusion is done with in a therapeutic environment, like you have an infusion with a psychotherapist walking you through stuff, and you have the prep and the experience and the integration, the whole package.
Right. You might have more help retraining your brain. I mean, that's a part of it, isn't it? And
that's great. Yeah.
Yeah. So I guess we're back in results may vary territory, which always seems to come up around all drugs and healing work and everything in life. But okay, so we've got molecular, we've got the infusion. Oh wait, one other thing on the infusion. So infusion can be it can be a series or it could be a one-off. Is that
Do you
right?
know what? I don't provide the infusion, so I can't speak directly to
Okay.
it, but it
Okay.
is
Okay.
generally recommended from what I hear as a series.
Okay. It's a series and it's generally for depression, but I think sometimes for pain. Is that right? Chronic pain?
Oh, oh, there's a lot of infusion for pain, and there's a lot of infusion for like intractable pain, which has
Mm.
been quite helpful. And there's also providers offering infusion for detox. So there's
Oh,
a lot of
oh, oh.
potential roles for this that are a
Mm.
little outside the scope of what I know and what I can speak about in more granularly. I just know
Yeah.
that they're very potentially beneficial, and it's like a rich area for us to continue to study.
And if let's say I had a client who's on a handful of antidepressants, but they want to go into a deeper treatment, is ketamine sort of lenient when it comes to being able to be on other medications, or do you need to
Yeah,
wean?
it said ketamine plays well with others.
Ah, okay, that's
You
good.
know,
I can
unlike
remember
the
that phrase. Yeah,
yeah, like
yeah, yeah.
psilocybin and MDMA, not so much. Ketamine's pretty friendly with most other molecules.